My name is Anne. I'm one of the senior speech pathologists at the Royal Adelaide Hospital within the Carlin Speech Pathology Department. Speech pathologists within Carlin work with patients who have swallowing and or communication difficulties, so we assess and manage those impairments for our patients, and that works right from the continuum of care from the emergency department right through to rehabilitation and our onward services in the community.
My name's Adam and I'm a senior speech pathologist at the Royal Adelaide Hospital within Carlin. We are known for our work with communication. I think the name speech pathologist is sometimes very misleading. However, a huge part of our role is working with people with swallowing disorders, and that takes us across services throughout the hospital.
We see patients with swallowing and communication impairments for a raft of different reasons, and that might be people who have had head and neck cancer surgery or the impacts of head and neck cancer, right through to our general medicine population who have the impacts of general illness and weakness on their swallowing. Also looking at our stroke patients and even our ICU patients who have critical illness, weakness or the effects of being intubated and the condition that underlies their reason for being in the ICU. As a speech pathologist, we also work with patients who come in under our trauma service and they might have a head injury, and we work with them on assessing post-traumatic amnesia, but also looking at patients in the ICU who have tracheostomies and working within a multidisciplinary team to progress that tracheostomy to the point of decannulation.
A very common misconception is that we just work with children. Carlin Speech Pathology is a service that only looks after adults across the continuum of care, from the emergency department through to rehab services and in the acute hospital, of course, on the wards.
Some people do. So some of our clinicians certainly work in the outpatient department and they work with patients for voice, so the assessment and management of voice conditions. We have a swallowing outpatient clinic that we run, but also we have a strong head and neck service, so working with our ENT colleagues in the assessment and management of patients who've had laryngectomy, but also those who've had impacts on swallowing related to head and neck surgery and the impacts of radiotherapy.